We turn now to the make-or-break debate over health care. We have two chambers of Congress made up of two parties trying to agree on one reform bill. Good luck. Well, in the Senate, the chairman of the Finance Committee has released a plan that could appeal to enough Democrats and Republicans to pass, but it does not include the government-backed insurance, that so-called public option. Over in the House, several progressive Democrats who say that's essentially a deal breaker. And one of those is our next guest, Congressman Anthony Weiner, Democrat. Good morning to you, sir. Thank you for being here.
It's my pleasure. Good morning.
Well, this was a much-awaited, highly anticipated bill coming out of the Senate Finance Committee. We have seen it, but from what you have seen and what you know right now, after all that work, is this thing in the House essentially dead on arrival?
Well, unfortunately it is. I mean, I commend my colleagues in the Senate for moving the process forward, but they didn't really make much progress in terms of trying to figure out a way to hold down costs for health care. You know, whether you're a fiscal conservative concerned about the idea that we need to get this under control, which is something we all should be, or someone who's concerned about having choice and competition in the marketplace, the Baucus mark doesn't accomplish either of those things, and that's problematic.
And Congressman, you said you appreciate them moving the process forward, so I guess you said it's dead on arrival. So how far did we even come? Did we make any progress with this bill?
Well, it's a necessary box we had to check. We had to have the committees of the House and Senate do it. Now we have 5 committees in the House and Senate. That's closer than we've ever been, and since we passed Medicare 44 years ago. But unfortunately, the Senate bill is probably going to have to be improved a great deal, if not just put aside and we start with the House bill. You know, the president has said he wants a public option. The American people say they want an option. And frankly, common sense dictates it. So I think it's got to be in any plan.
And you talk about the public option there. You say the president wants. But he said in that joint session, aside from some of the other theatrics, there was some news the president actually made in there, and saying that the driving idea behind reform has been to end insurance company abuses and make coverage available for those without it. The public option is only a means to that end, and we should remain open to other ideas that accomplish our ultimate goals. So you say the president's behind it, but he doesn't seem to be behind it in the way you are, which means it has to be in there or no bill.
Well, that's not true. I think basically the president is just saying the same thing. Earlier in that speech, he explained why the public option is so necessary. Look, maybe there is some other tool to keep down, certainly not in the Baucus bill. Look, we say to insurance companies, here's another 30 million customers, but they don't do anything to make it so the cost for that insurance starts coming down so we can all afford it and so the taxpayer isn't bankrupted. That's the problem here. It's fairly easy to provide someone with coverage or give them a subsidy to go out and buy it, although the subsidies in this bill aren't high enough. But unless we contain the cost, it's going to continue bankrupting our system.
And do you think, you mentioned there that you don't think that's what the president was saying, or he laid out the need for a public option, and yes, he says he wants it, but I think a lot of people would agree it's been clear that he has backed off and he doesn't have the same stance you have, at least, which is the public option must be in the bill. You think you and the president see eye to eye?
Well, I think so. I mean, the president did say in that speech he wants the public option in. The American people have said that, too. He said something that, frankly, I'd agree with. If there's another tool to contain costs and competition, he's open to it. But, for example, in the Senate bill, they have something called co-ops, which allow people to do it state by state and then wouldn't allow them to join together as individual co-ops. It doesn't really do it. So unless someone has a better idea they want to put on the table, there is no alternative now to the public option. And let me make it very clear, for 200 million Americans, including you and me, we won't be eligible to go into the public option anyway. It's really just for a small sliver of the population.
All right, so I want to make sure I'm clear that it doesn't sound like the co-op, at least the way it is in his bill. You think it could be improved in some way and you could get on board with the co-op plan?
Well, there hasn't been a co-op in the country that's worked the way, you need something big and muscular to compete with the insurance companies. And if we're saying you can only do them by state, and those co-ops can't join together and negotiate for prices around the country, you're basically just not going to have a big enough heft to be able to do it. The co-op is a nice idea, except it won't accomplish what we need, which is true competition.
All right, and last thing, essentially a yes or no. Does bipartisanship even matter to you on this bill anymore? Sure, you would like it, but you're okay going ahead without it.
I think you put it exactly right. I'd like it, but as a means to an end, not an end in and of itself. It's pretty clear many of my Republican colleagues have decided they'd rather not help with this process, and I understand that, so it's our job to get it done.
Well, Representative Anthony Weiner, again, Democrat from New York. Sir, we will be talking to you plenty throughout what is looking like is going to be an extended health care debate. Sir, thank you for being here this morning. You have a good one.
Thank you. I look forward to it.